At a time when the country is fighting a deadly coronavirus pandemic, non-COVID patients or those suffering from ailments and health conditions other than coronavirus are struggling to get treatment. Now, to understand how non-COVID patients are suffering during a pandemic where much of the focus is on coronavirus, we are in conversation with Dr. Soma Shekhar SP, who's the chairman and HOD at Manipal Comprehensive Cancer Center, Bengaluru. Thank you so much, sir, for taking our time and speaking to me.
Thank you very much. Thank you for welcoming, and it's a pleasure to be with you.
Thank you, sir. So to begin with, I'd like to ask, if we go by the data, nearly 57% of non-COVID patients canceled their treatment between March and December 2020. Now, many of them approached hospitals, but they were turned away by the doctors and the health workers. And even in rural areas, the situation was like a nightmare because these people traveled to cities and towns for treatment and there were no beds. They were not given treatment because they did not have a COVID negative certificate. Now, what do you make of this situation? How prepared were we to sort of maintain a balance between the treatment of COVID patients and non-COVID patients?
This is very sad. Actually, I authored a lot of articles, including in international and national, and wrote a guidelines for cancer management during COVID time. Many people actually forget the mortality of COVID is less than 0.5%, which means 99% recover well. But there are other diseases which already India suffer, communicable, non-communicable, where the mortality is very high. And it's like, everybody is now concentrated only on COVID, all bets reserved for COVID, lockdown, phase 1, phase 2, phase 3. People are all like, afraid and apprehensive about COVID. Whole doctor system is managing only COVID. Unfortunately, for a country like India, and more so with many other places, other most important health issues are totally neglected.
Absolutely.
Because first of all, people think, oh, I have a cancer, no problem. As long as I'm COVID negative, I am fine. Let me concentrate my COVID cancer can wait. Or they say I'm a hypertensive diabetes. No, there is a huge suffering of non-COVID other health system, which is very unfortunate. And we noticed as a doctor last June, July, September, when we had a COVID surge, all of them sat in home non-COVID. And by December, Jan, when things eased out, they all came in very advanced disease, very late, and they had a lot of mortality. Like, for example, I'll tell you, in India, as per the statistics, which are the health system which severely suffered cancer treatment. This is the number one during COVID phase we suffered. Number two, cardiac issue, ischemic heart diseases, cardiovascular disorders, tuberculosis, HIV treatment, and contraceptives in females, maternal health care, and non-COVID other immunization. These are the 7 fields which tremendously suffered. And we saw that backlog coming very late in Jan, February, March, and again we had a second wave.
Yes.
So little bit non-COVID was picking up. Now everything is COVID. And I'm afraid last year first wave was not as bad as this. Then only in these 7 fields I told suffered so much. Cancer patients as stage migration. They had a stage 2, they sat in the home because of COVID, they ignored other, they come in stage 3, stage 4, non-curable, or they need chemo radiation. We have started noticing a lot of people coming with sudden heart attacks. Initially, chest pain, they used to come, we used to do ECG, echo, angio, and then identify, treat them. Now, more and more, especially 40, 50 year coming to casualty straight with advanced cardiac problem neglected. Uncontrolled hypertension, diabetes, maternal health problems, TB, HIV, contraceptive, all this suffer. So I'm really worried we are in the peak of second wave. Say by June, July, if things settles down, the impact of these 7 neglected health cares, which would come back in August, September, October, would be 5-folds for us, which would be very sad.
Absolutely, sir. So talking about cancer patients, there have been a lot of allegations that several medical colleges had stopped, admitting or seeing critical patients suffering from ailments like cancer, as you mentioned. Now, the allegations that hospitals have discontinued chemotherapy. Now, as an oncologist, what do you think should have the government or the healthcare infrastructure done to, cater to patients who are suffering from serious ailments like cancer, diabetes, other ailments, and COVID? How do you maintain a balance?
Absolutely. I fully agree with you. India is such a thing. Unfortunately, private healthcare caters to a lot of health treatment than government. Now, for example, All Indian Institute of Medical Science almost closed down for 3 months last because they are the largest COVID people. Elective surgeries were stopped. Even now, between March, April, May, elective surgeries stopped, and now they're planning to open. And remember, these cater to huge amount of middle class, low class people. So what policy decision consciously should have been done is, yes, pandemic is important. We are in a communicable disease, yes, important. But there are other diseases where untreated mortality would be 50%. 1 in 2 will die, like cancer, cardiac, TB, HIV, maternal health. We should have carved out a two-pronged strategy in each hospital.
Right.
Like, 2/3 of the staff concentrate for COVID. The other 1/3 within institutions separate off, and unhindered care of cancer, cardiac, tuberculosis, all this should go on. See, nobody is denying a treatment for them, but the thirst by the unwritten rule, there is no rule you don't treat a cancer patient, no government has told, but consciously in an institution, these services, like, we could have moved to home-based ambulatory chemo. We could have had a chemo center going into the peripheral areas instead of patients coming and going. So this life-saving strategy should have been done. 1/3 of the health system people should be taken out from COVID and should have kept for this, and publicize well for the patients that yes, COVID is important. Take all the COVID measures. Whenever you are indicated for vaccine, take it, but don't neglect your cancer, cardiac, tuberculosis, HIV, contraceptive in female, maternal health care. And we have made this at all the level. See, these are actually reaching the people at district and taluk level. So we should have strengthened the main cities for COVID care. And also in district and health, we should have carved out, okay, now remember, every day you're available for COVID advice and management, but alternate day afternoon 2 to 4, cancer care is going on. Please come, don't miss your chemo. Okay, now if you are a patient of TB, remember, see, in India, 1,400 people die of multi-drug resistant TB. That is when we were not having COVID. And those people, we used to beg, government used to call them, please come, free drug we are giving for 6 months, take this and test. If then we lost 1,400 people, and now imagine in COVID time, everybody has forgot TB, even if drugs are there, not there. So we should have carved out within the system, in a system, to take care of this 7-8 non-COVID treatment. Doctors' machinery should have carved out. Policy drugs should have carved out. Good publicity should have been given. Every day we are available for COVID care, but Tuesday is TB day, Wednesday and Saturday is cancer free consultation day. Chemo should continue with COVID protocol being followed. So we should have done this, allocated funds like this, healthcare system should have done, made aware of the people that don't delay. Well-treated COVID, 99 people become normal. Your cancer is not going to wait for 4 months. 2 months in cancer changes everything. Multi-drug resistance TB will change everything. And in India, we have 25 million hypertensive people, 77 million diabetic people. Now these people untreated, not measuring their BP, checking their sugar, getting treated with their general practitioners, they all end up with cardiac problem, neural problems, strokes. So we have to tell them that, these are something. I'll give you one example. In India, what happened last year when phase 1, immediate COVID crisis happened and lockdown just happened. In 50 days in Agra, which has got large number of TB, 145 TB patient died. In this era, TB patient don't die. It's not a cancer. It is not a COVID thing or anything. Good treatment is there. 145 people in Agra died in a matter of 54 days. That shows that the whole COVID crisis deprived, or the people were totally defocused. So imagine last year, just in 50 days of COVID crisis last year, now how many would have died now? And in India, 77% of women normally use these ANC government services, maternal health, folic acid, iron, 4 checkups in a year. But now there is a data, 77% of utilization has dropped down to 50%. So imagine in rural middle area, 77 people, the non-COVID time only utilized. So that saves the life of a mother and child. Now it has dropped down to 50. So what is its impact? We're going to see 6-7 months during delivery. So child health, infant mortality and all will rise. So immunization, other thing has suffered, and HIV treatment has stopped. Cancer, now I've seen a lot of patients coming with stage migration, advanced stage, where we could have cured with one modality. Now they need chemo, radiation, they're coming late, mortality has jumped up. There is one statistics where 30% of cancer advanced disease happened during this COVID because of neglecting it.
Right.
So 30% of the patients became advanced, that will have an impact of 50% mortality. And tuberculosis, women health service, all this has suffered. So we should have sort of, decided and carved out and made the people, that is also important. This is also important. Policy decision, good publicity, and healthcare system should have sort of been geared up to it. Unfortunately, we were not. And now people are understanding and starting this.
Absolutely. I think you made a very crucial point, Doctor, that even though we have to focus on the current pandemic, it does not mean we drive our attention and our focus away from the existing ailments and the existing diseases. I think that's a very crucial point to understand. And Doctor, as I mentioned, when everyone is talking about coronavirus and COVID-19 and this one deadly virus, do you think there are certain specific ailments or health diseases that have been severely neglected? And by diseases, I mean these diseases can actually have, can actually pose a threat in future, especially in a country like India.
Absolutely. Out of all the three main things are cancer, cardiac, and tuberculosis. And these are severely neglected because cancer treatment is a very long treatment. You have a surgery, then you have chemo running for 6 months, then radiation for 2 months, which means each patient needs 7 to 8 months. Totally, people are not coming. Radiation is every day coming for radiation for 6 weeks. As it is already analyzed, 30% of the people are affected by change of their outcome and more deaths in cancer. This is number one, which is totally affected. Chemotherapy, radiotherapy, surgery. And number two is ischemic heart disease, hypertension, diabetes, cardiac. Number two, which is having direct impact on the death and mortality.
Yes.
And the third one is tuberculosis and maternal health care. These four significantly are affected, and its impact is going to be seen in next 3 to 6 months by doubling the incidence of deaths, doubling the incidence of coming in advanced state. These four have a huge beating in India, which needs emergency course correction at this moment.
Absolutely. Doctor, especially after the coronavirus pandemic, there's a lot of conversation and increased focus on healthy lifestyle and healthy habits and healthy habits, healthy way of life, a lot of other things. Now, how do you think can we increase awareness about all of these things now? Because even when the coronavirus pandemic struck us, a lot of people said that people in India are not aware about how important, say, as basic as washing hands is, or how important is it to wear mask when you've been asked to told, especially at a time of a virus. So people always, blame a lack of awareness in the country. How do you think can we inculcate such habits in people?
Absolutely. You are absolutely right. As a society, we should never think this is one of a time. This COVID pandemic may go down, but COVID would persist lifelong. And there may be many other diseases. So we need to change our whole thing. Personal hygiene is very important. If we have maintained personal hygiene, hand washing, taking good nutrition, good rehabilitation. I know in India is a condition where a lot of people share one room, roof, big family, nuclear family, everybody stay. So we need to cultivate ourselves a good hygiene, Now I think masking in some form at all the places would stay even if COVID goes off. You may be vaccinated. CDC USA in USA has allowed people to remove masks, but in some form of mask, personal hygiene, personal nutrition, hand washing, maintaining self-hygiene and translating that to your surrounding people is going to be a huge impact.
Absolutely.
And second, we never invested in healthcare in India. People thought, okay, having a real estate, car, everything. Now they understand there's no value of any of them. Now every individual should look at investing their whatever earning, even if you earn 2 rupees a day on your health, having a medical insurance, having a good robustness, at our taluk level, district level, increasing the healthcare system. So as a government organization and, policy maker, decision maker, they have to strengthen the healthcare system to reach to the last level of the village, not just good in metro. At individual level, now we understand health is wealth, true meaning. Invest on your good hygiene, rehabilitation of your, physical fitness, not to be obese, control your diabetes, hypertension, taking good nutrition, maintaining your weight properly, not being obese. Now this is something which every individual has to maintain, and there has to be a paradigm shift that should happen in all the places. Otherwise, we are going to be, COVID will go, there is something else we'll hit if we don't maintain our personal things.
Absolutely. These are some very important tips, and experts and health workers have constantly reminded us to follow all these. Thank you so much, Doctor. Now, also, Doctor, looking at the current scenario amid the COVID situation across the country, how prepared do you think are we for diseases and viruses that can come up in future? Because now when the COVID pandemic struck us, especially the second wave, the entire health infrastructure collapsed and it wreaked havoc in the country. So how prepared do you think are we for the next viruses or any other thing that comes up in future?
To be frank, this same question pre-COVID, we were pathetically not prepared, not even 1%. Now, having taken 2 hits, now people are getting geared up to tune of 30 to 50%. Still long way, but now we are better than pre-COVID for other emergencies. Now people understood, oxygen, medications. So we are not yet there, but far superior to what we were in beginning of 2020.
Okay.
But still, this is at individual level. In a society, we can't have a national impact if people at individual level try to do. There has to be huge policy shifting. See, now, for example, when there is a big earthquake that happened in Gujarat, or, when we had this problem, then the national disaster management thing came. Then the policy for national trauma happened. Okay, if you have a mass scale trauma, like famines, or suppose you have, typhoons hitting, now there are protocols available. This. Like that, for health disasters, still we don't have a protocol. Suppose there is a gas outbreak. Suppose there is a virus outbreak. Suppose there is a tomorrow cluster of unknown infective infections or unknown deaths happening in an area and in which is spread all over India. So now we need to have a national disaster management, like the national disease disaster management protocol needs to come up. And what is the first response system? Suppose it happens in one relative village in, say, Orissa, Karnataka, Delhi, Bombay, somewhere. What is the first response? What team should be there? How to isolate them? How to put tents? How the medical system should be set up there? How we do food, nutrition, oxygen, healthcare. So 1, 2, 3, 4, 5, 6 protocol to contain it, and how to contain them so it doesn't spread to other states. So we need to now write a protocol, make an SOP for them, and look at both policy established and moving of the infrastructure and educating the people. So we are about 50% now because of the bad lesson we learned from COVID, but still we are not yet there. But this is a wake-up call for us to look both at bureaucratic, policymaker, healthcare system, and at local level to have a pre-existing SOP. And then where do you get the infrastructure to immediately mobilize and do it? And then what is the policy to contain that spread? So we need to work a lot on that. We need to do that.
Absolutely, sir. A little too late, but yes, this is a wake-up call for the country and the health infrastructure. I'd again like to thank you for taking out time and speaking to me, sir. You've made some very crucial points and given us a detailed insight into the coronavirus pandemic. Thank you so much for taking out time.
Thank you. And also, like if you look at in India, we didn't do a survey exactly what was the impact of these 7 conditions, but UK did a similar survey. That UK brought out a paper in Lancet, which showed that because of this COVID crisis, 2.4 million people who are availing cancer screening has not availed. So if that is what happened in UK, then imagine 2.4 million people missed their cancer screening package. Now in India, you can know what has happened. But in India, there is a statistics which has brought out 50% of cardiac complications have increased because of not availing the non-COVID treatment during this. So these are something which are quite tough, and 80% of the patient who otherwise would have taken TB medicine to this DOT regime have not taken. So now you can know that this is a time bomb waiting to explode after 4 months. Absolutely. So once we come out of this COVID crisis, we need to fight these things. So we need to look for this, gear for this. We just don't want to come up from one well and fall into another well. So we need to understand that we need to look at all this and plug the loopholes so we are better prepared, and hope next year is a good sunshine for us.